Here's a Puerto Rico medical revalidation style question related to pain management in a patient with a history of peptic ulcer disease. Question: a 60-year-old male with a history of peptic ulcer disease UD presents with chronic knee osteoarthritis and requires oral pain management. Given his history of gastric ulcers, which of the following is the most appropriate analgesic to minimize gastrointestinal side effects? A. Ibuprofen. B. Naproxen. C. Celecoxib. Correct answer C. Celecoxib. Explanation: nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, naproxen, and aspirin, inhibit cyclooxygenase, COX-1 and COX-2 enzymes, reducing prostaglandin synthesis, which leads to gastric mucosal injury and increased risk of peptic ulcers. Celecoxib is a selective COX-2 inhibitor, meaning it spares COX-1, which plays a protective role in maintaining gastric mucosal integrity. Because COX-1 inhibition is the primary cause of NSAID-induced gastric ulcers, celecoxib is preferred in patients with a history of peptic ulcer disease who require chronic pain management. Incorrect answers: ibuprofen A and naproxen B. Both are non-selective NSAIDs that inhibit COX-1 and COX-2, increasing the risk of gastric ulceration and bleeding. Aspirin D, an irreversible COX-1 and COX-2 inhibitor. Aspirin significantly increases the risk of gastric ulceration and should be avoided in this patient. Key takeaway: for patients with peptic ulcer disease requiring pain relief, COX-2 inhibitors like celecoxib are preferred due to their reduced gastrointestinal toxicity compared to traditional NSAIDs.